We're back at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association. I'm your host, Rich Helppie, from the Common Bridge podcast and Substack page. We're talking to Dom Pallone. He is the chief executive of the Michigan Association of Health Plans, and we're going to talk today a little bit about affordability and just exactly who the Michigan Association of Health Plans might be. Dom, welcome.
Thank you. Thank you for having me, Rich. I appreciate the opportunity.
Glad to have you. Let's just start with the basic. Tell us about the Michigan Association of Health Plans.
Yeah. So we're a state trade association located in Lansing, Michigan, and represent 9 health insurance companies. All of your major names that you've heard of around the state. Local names as well. So my board chair happens to be from the Upper Peninsula Health Plan. And then we have other members that represent Aetna, Molina, Centene, etc. So our work in Lansing is to be their voice and advocacy arm, working with state lawmakers and regulators on all things regulatory and policy issues at the state level around healthcare and around insurance coverage of our members of the state. Collectively, our members cover close to 4 million Michiganders.
Is that right? I'm very impressed with that number in that this state has been dominated by one player for some time. It goes back to our UAW Teamster roots, yes. I suppose. What are some of the challenges that you have with your group?
Yeah, well, that one dominant carrier is not part of our group, and so a big point of emphasis of our members is on competition and choice, especially within the commercial marketplace. So a lot of our activities is trying to let healthcare purchasers, most often employers, large group, small group, or sometimes individual families, know that there are other options available, that there are other networks available. In an ideal world, we want to be competing over quality and outcomes, making sure that we're providing the best health outcomes and best access to care, partnering with hospitals throughout the state to do that and other provider groups throughout the state to do that, and really showing the people of Michigan that they have choices as to who's going to provide their healthcare coverage and access to quality healthcare in our state.
Well, I'm glad you made mention of access and quality, and of course the other leg of that is hovering above us, and that's of course cost and affordability. And have you done work, or how are your members doing in terms of addressing the affordability issue?
Yeah, we're very focused right now on affordability, and it's certainly the buzzword of the year so far. Absolutely so in healthcare, not only other areas of our daily lives, but in the healthcare space, insurers often are pass-through entities for that cost. But we're trying to partner the best we can with provider organizations throughout the state. Our membership prides itself in wanting to work with hospitals, big, small, medium, wanting to work with provider organizations throughout the state to find the best value for our purchasers. Oftentimes that means trying to work through value-based arrangements, payment arrangements for those providers. So we see a lot of our members doing more in that space today than ever before, and they're excited to do even more. One of the biggest challenges, though, that we continue to see is pharmacy costs and the impact that has on overall affordability and the downstream impact it has on insurance premiums. We've seen insurance premiums go up by double digits in our state. Doesn't matter what market you're in. We see that trend as a scary trend. We want to course correct. We think pharmacy is really the biggest lever that we need to work on greater state regulatory efforts to rein in some of the pharmacy spend that we see and the cost of some of these drugs that are out there. Truly groundbreaking, remarkable treatments. We don't want to discourage investment at all in the U.S. and certainly not in Michigan in drug manufacturing, but we can only afford so much, unfortunately, and we're seeing drug affordability issues drive insurance affordability issues right now in our state.
I can imagine that in some of the populations that you serve would be particularly acute. Trying to explain healthcare financing to a person not affiliated with the industry is hard. What steps are you and your members taking to maybe help the average consumer understand that?
Well, you're absolutely right. Like, health literacy is a focal point of a lot of our members. And so things as simple as just maintaining their call centers, making sure that they have an actual human answering the phones and talking through with people what their coverage looks like, what it means to have coverage. Oftentimes, the individual is not the one making the purchase of their healthcare coverage. It's their employer. In the state of Michigan is most often the case. And in those scenarios, it's working both with the employer's HR team, but also with the individual members themselves, the enrollees themselves, to explain the benefits that they have and to try to educate them a little bit on how best to use those benefits. And by that, I mean, we're seeing a lot of tools come to place here in Michigan from the insurance side, trying to encourage the individual to shop for their healthcare coverage based on some of the value and quality that we see from claims data. It's very in the weeds stuff. It's very hard to explain to the average person, but to the average person, it means using an app, right, at the end of the day, and saying, if I have an elective procedure, let me look on that app. Let me figure out the provider that's going to provide the best value to me. That could be healthcare quality outcome scores. That could be cost. It could be both. But that's really the newer frontiers that our members are navigating and trying to help explain to individuals throughout the state that they have some power in that, right? Nobody likes when their copay is high or their deductible is high. So we try to do our best to explain why that is, what their employer has selected and why that might be the case, and then empowering that individual to do the best they can to keep their personal costs low, but yet still maintaining access to quality care.
So a little more custom designed.
Yes, yeah, a lot more custom design that we see these days. So sometimes that takes the form in high value networks. So we'll work with employer groups and providers to tailor a network of providers that are more attuned to that community where maybe the employer group lives. Oftentimes it's just trying to figure out, is the provider group willing to negotiate on a value-based payment arrangement? And if so, great, we want to send our members to those providers to get service because we know that member is a trusted partner in providing high-value care.
Terrific. Any final comments or thoughts for our audience today?
Well, no, I just appreciate the discussion as always. We've got a lot of work ahead of us in the state. I don't think anybody that is in healthcare is happy with the state that we find ourselves in. I hear it from my family members and friends and family across the state that we've got affordability issues at play, and we've got some hard work ahead of us. We're excited to work with partners, the MHA, other partners that are willing to take this on. And as I mentioned earlier, I think the pharmacy levers are the policy levers we need to be focused on right now in our state. So we're excited to roll up our sleeves and get to work doing that over the next few months.
Great. We've been talking to Dom Pallone. He is the Chief Executive of the Michigan Association of Health Plans. On behalf of the Michigan Health and Hospitals Association and the Common Bridge, this is your host, Rich Helppie, signing off.